Hello, yeah.
Hi, so thanks for joining us today, Eleanor, and thanks so much for giving up your time to do this talk. So just to introduce yourself, you're a paediatric physiotherapist at Alder Hospital. So I think today you're going to provide a bit of an outline about what the job involves of a physio in a hospital and some of the skills needed and some of the routes and training into this role. Yeah, okay.
Yeah.
So have you got your presentation there to share?
Yeah, let me share my screen with you. So there we go. Can you see that?
Yeah, we can see that. That's perfect. Yeah, if it's okay, we're going to record this, but we won't record the questions after. Okay.
Yeah, that's
Thank
fine.
you. Cheers. Thank you.
All right. So my name is Eleanor Carter. I am a Band 5 physio here at Alder. So currently on PICU, which is our Paediatric Intensive Care Unit. Sorry. So just a little bit of background. So obviously you've had a big talk today about obviously what physio is, but just as a general kind of guide. So physio is an evidence-based profession which helps people affected by injury, illness or disability through movement and exercise, manual therapy, education and advice. So it's a very kind of broad statement of things. And there's lots of different areas which we work in. So obviously you've had talks from different professionals and where they're working within the hospital. It's pretty much any healthcare area you can think of, there'll be a physio that works there. So sort of we do absolutely everything. And then a bit of background about Alder. So obviously training in Liverpool. I'm assuming most people know a little bit about Alder, but not everyone does, especially if you've not come from the local area. So Alder is a tertiary care centre, which means it's kind of a big hospital essentially, which serves the children and young people of Liverpool, Merseyside and beyond. We treat 330,000 children and young people every year and have 270 beds, including 48 critical care beds. So it's the dedicated children's major trauma centre, so any children that are involved in a major trauma kind of within the local area. So we have children from up in Lancashire, we have children from Wales, they're all coming to Alder. So if anyone's in a helicopter, they're coming to Alder kind of thing. We're the regional cardiac surgery centre and are a centre of excellence for cancer and then also for spinal, heart and brain conditions, and we are ranked the 10th best children's hospital in the world and the 2nd best in the UK after Great Ormond Street. So we're very busy. We see a lot of kids from a lot of different areas and do lots and lots of stuff with them. So what are the kind of physio roles within Alder? So we tend to work within 3 different areas. So we have orthopedics, which is generally what you might think of when you're thinking of physiotherapy. So that can be either inpatient orthopedics, so on wards, or outpatients. We see a big range of different conditions, but it's mostly a lot of lower limb surgeries, so surgery on your legs. And that can be either elective surgery, so they've noticed there's a problem with someone's legs and they need surgery on that to correct it, but also trauma surgeries, spinal surgeries we see a lot of. We also do quite a bit of rehab for some of our patients, so they come in for a week of dedicated physio rehab that we do, and that also covers the burns and plastics centre as well. So any children that have burns or need plastic surgery, we see them and they come to us. We also have a hydrotherapy pool that fits within with that orthopaedic team as well. So that sees any of the orthopaedic outpatients that need to be seen from a physio perspective in the pool. So it can help with things like if they're not allowed to walk properly yet, they can go in the pool and they can practice their walking without putting too much weight through their legs. It can help with balance, it can help to stretch things out. It's really, really nice warm water. So we do a lot of stuff within hydrotherapy, and we also have our limb reconstruction service as well. So this is if you've ever seen people, especially with like bad breaks, that have a big like frame on the outside of their leg or like a rail on the outside of the leg with pins going into the bones. We have a big service of that. So either trauma things, if you have a really bad break and the need to stabilise it with an external fixator, a big frame, or if some of the children have problems with the way that their legs are rotated, or one leg is shorter than the other, or things like that. We'll put a frame on to make their legs longer or change the direction of them and things like that. So we see a very broad range of people. We then have our neurology service. So this is kind of split into 4 different teams. So we have our acute neurology team. So this is seeing children that have had strokes, children with traumatic brain injuries, spinal cord injuries, or things like that. We then have our oncology service. So they see obviously children with cancer, and they see a lot of the brain tumour patients as well, because they'll then have problems with their neurological symptoms. We have our STARS service, so they are the Spasticity Tone Assessment Rehabilitation Service. So they see children with conditions that would cause them to have problems with like tone, spasticity, so things like cerebral palsy, stuff like that, and they're really involved in their rehab, especially after they've had certain surgeries. And then we also have our neuromuscle service. So they see children who have different neuromuscular conditions, normally muscular dystrophy, things like that. So you might have heard of like Duchenne's muscular dystrophy, or SMA, spinal muscular atrophy. Generally, these are like degenerative neuromuscular conditions that over time the child will be less and less able to move, to walk, to do things. So our role involves helping promote that movement, do as much as we can, and promote like quality of life with these children, because their life expectancy can be quite short. And then finally, we have our respiratory service, which is a service that I currently work in and tends to be the one that people know about the least. So within respiratory, we kind of cover 2 different areas. So we cover the general wards, and that's our like medical service. So they see children after they've had operations on either their lungs or just general sort of surgical operations. So like if you have your appendix out, things like that, they might not be breathing as well as we want them to be. So our job is to improve their breathing, improve their like secretion clearance, so getting the phlegm up off their chest to prevent infections, improve their walking around, all stuff like that. We also see all of the cystic fibrosis patients and any patients that are on long-term ventilation. So if you've heard of like people that go on CPAP overnight, where they're on like the breathing machine overnight, if they've got apnea and stuff like that, we see children that have that as well. And then we also, the rotation I'm on at the minute, which is the Paediatric Intensive Care Unit, or critical care. So we see the most acutely poorly children in the hospital. This can be, we have a lot of post-op cardiac surgery. So if they've had surgery on their heart, they tend to come up to ICU and we treat them there. It can also be children that come in with really bad chest infections, like bronchiolitis, things like that. Also, if they have a cardiac arrest or a respiratory arrest, or like any big major traumas, big brain injuries, things like that, they'll come on to critical care, which is where they tend to be intubated, so they've got the tube going down their throat, and then they're on a ventilator that helps them breathe. And obviously when that's happening, they can't then cough, they can't breathe normally, so we help to clear their lungs, make them breathe as well as we can, and then aid them in coming off the ventilators and breathing for themselves. So currently, my current role is as a rotational junior physiotherapist, and I do 6-month rotations across Alder. So all of those different areas that I've just talked about, I rotate across all of those different areas every 6 months. You might hear me say things like band 5, band 6, those type of words. Band 5 is like the entry level band into the NHS. So anyone that qualifies with a degree and goes to work in the NHS, you start off as a band 5. So that would be anyone except for doctors. So it's physios, nurses, radiographers, orthotics, OTs, everyone. We go in as band 5s, and then as you then get more experience, you can then apply up the bands, and it goes all the way up to a band 8. So it's just like your pay band, but it's your level of experience and responsibility, essentially. My current rotation at the minute is on PICU, which is the Paediatric Intensive Care Unit. So I work Mondays to Fridays, 8 AM to 4 PM. We have a late service, which is till 9 PM every day. So there's a physio in the hospital until 9 p.m. And then we also have an on-call cover service. So there's a physio every night who is on call, so can be phoned at any time during the night to come in to do some treatment with any of the kids that need it. And we also offer a full weekend service as well. So it's quite a lot that goes on behind the scenes. And just a bit of a background, I've kind of talked about this already, but what is physio on PICU? So our goal is to aid secretion clearance, so getting the phlegm out of the lungs while the patients are intubated and ventilated. And then we also review their movement, strength and positioning. Because obviously, as you can imagine, if someone is completely sedated, so they're put to sleep, something is breathing for them, and they're potentially like that for a couple of weeks, even more, they're going to become stiff and weak. So we're involved in making sure that they still move right. And then as they are weaned off that sedation and start doing more, we're getting them to get up, get walking, depending on their age and what they can do. For the babies, it's about making sure that they can have cuddles with mum and dad. They're getting out of their bed. They're doing a few more things just to promote that development and also their general movement to prevent any issues long term. So I think I heard when I joined the call about the last speaker talking a little bit about the different ways to get into physio, but just as a bit of an overview. So there are three main ways. Obviously, physio is a protected title. So in order to call yourself a physio, you obviously have to have the degree in physiotherapy or the degree apprenticeship and be registered with the HCPC, which is the Health and Care Professions Council. So that's our regulatory body to make sure that everyone is doing everything that they should be doing. So generally the physio BSc, you tend to need AAB at A level or a 2-1 honours degree in a biological, biomedical or health science subject. They tend to accept sports science as a health science subject. It's a 3-year course, mixed kind of academic and clinical, and is assessed via exams, OSCEs, assignments, placements and dissertation. And through that degree, you'll complete your clinical placement. So in order to qualify as a physio, you have to complete 1,000 hours of clinical placement, and that is assessed as well. So you're marked on what you're doing on placement and things like that. Also now the physiotherapy master's degree, so this is a pre-registration master's, which is only a 2-year course compared to the 3-year BSc. It also requires a 2-1 honours degree in order to apply to it, and again is like mixed academic and clinical. You're still assessed in the same way, you still have the same amount of clinical placements. It's obviously just shorter because it's only 2 years, so it's a bit more, from what I've heard, rapid in the pace of everything. And then finally, there is the physiotherapy apprenticeship. So this is relatively new, and it's a degree level apprenticeship. So usually you need to already be employed as a physio assistant within a local trust, and then you'll complete a 4-year part-time apprenticeship alongside that working as a physio assistant. And often that can be funded through the trust. So we've got 3 assistants at the minute at Alder who are completing their physiotherapy assistant apprenticeship, and that is being funded by Alder. My general career path. So I was very boring and went to university straight out of school. So I did my 3-year undergrad BSc in physio at the University of Liverpool, and then I completed clinical placements across Merseyside within university. So I did some at the Walton Centre doing some neuro rehab. I went to Wiston and did orthopaedics. I did some community respiratory in Warrington. I was able to do paediatric respiratory here at Alder, which was very helpful because that's what I wanted to do. And then MSK outpatients at St Helens, and then I did an elective placement at my local hospital back in the West Midlands doing A&E. And then straight from uni, I then got a job at Liverpool University Hospital's NHS Foundation Trust, also known as LUFT, which is the hospital trust covering the Royal Broad Green and Aintree. So I started as a rotational Band 5 physio there, and that's obviously an adult trust, so there's no paediatrics in LUFT. And I did a range of different rotations. So I did MSK outpatients, which is like orthopaedic musculoskeletal outpatients, the renal and palliative care wards, and general medical wards as well. And then I was able to come here to Alder. So I did a 6-month out of trust rotation from Luft to here at Alder on outpatients here. Whilst I was here, I then got a permanent job here, and then since then I've done orthopaedic inpatients as well as now being on paediatric intensive care unit. So it's a real range of different things that I've done, and I think although I think that I want to be a respiratory physio, I'm very grateful that I've been able to do orthopedics, palliative care, outpatients, all those different things, because it means that you're then much more rounded and have much more general experience when you then start to specialise. So in general, the sort of what type of skills and experience do you need for physio? And I would say the most important kind of skills are these like top ones, as opposed to this bottom one of clinical skills. So it's skills that you probably already have and just need to then develop more as you then do your degree and look into physio if it's something that you want to do. So thinking about your communication skills, professionalism, time management, reflection and teamwork skills. So probably the most important part of any physio's job is communication. It's being able to communicate with your patient, for them to be able to tell you what's going on, for you to be able to explain things to them, to get them to trust you. We talk a lot about the therapeutic relationship within physio. So it's building that rapport, that relationship with your patients, so they trust you and they trust that you know what you're doing and you're doing the best thing for them. So your ability to communicate is such a massive part of that, and also communicating with the wider team as well. So although physio is an autonomous profession, so we mean we make our own decisions, we're accountable to ourselves, we can look at things, we can diagnose, we can decide what treatment we do and don't want to do. But we're still working within that team. We work really closely with the doctors, we work really closely with nurses, OTs, podiatrists, orthotics, everyone. We're in one big team, and especially within the acute hospital environment, you're working massively within that team. So it's that communication skills with all of your other colleagues within physio and in other teams as well. And that's where your professionalism comes in too. Your time management is a massive skill that you need to be able to have, and that being able to manage that big caseload, especially on some of the wards, you've got loads to do, not a lot of time, not a lot of staff. So it's having that management skills. Your general being able to reflect on things, being able to look at, okay, I've just done this, it went well, why did it go well? Or it didn't go very well, why didn't it go very well? And having that awareness within yourself and that ability to build on your experience and build on your knowledge. Physio is something where you're always learning. Yes, you finish your degree, but then you're then continuing on this journey of learning, education, your what we call like continued professional development. So you have to continue with a big folder of everything that you're learning, everything that you're looking at and doing. So that onward lifelong learning, we often say, is really important. Obviously, as we've said, team working, and then kind of at the bottom of that pile is your clinical skills, and that's something that no one expects you to have right now. It's something that you then build on at university, and then you build on in placement and working, and it's something that kind of just comes with time. In general, what experience do we need to be physios? So I would say before you even decide that it's something that you want to do, get some work experience and get a really broad range of work experience. So looking at, yes, within sports, if that's what you're most interested in, so with sports teams or private clinics, things like that, but also get that experience in hospital environments, in those slightly weird and wonderful areas that not as many people know physio work in. So coming onto ICU or respiratory wards or just general medical wards, seeing what physios do. And if you have that understanding, it comes across really well in personal statements and also interviews when you're applying. They want to know that you know what you're getting yourself into. They want to know that you understand that physio isn't just going to be you running onto Liverpool football pitch on a Saturday. And you know that there's a lot more to it, and there's a lot more work that goes into all the different aspects of it as well. Having some experience and being able to demonstrate like teamwork and leadership skills. So this can be within the sort of clinical or healthcare environments, but also out of it. So things like having done your D&V, being able to being part of, I don't know, a club, or doing some out of sort of extracurricular stuff that shows that you've got that teamwork skills, being on a sports team, just something else, even if it's not within physio or within healthcare, developing those skills and showing that you understand the importance of them in relation to physio. Volunteering is a really good kind of way in as well. So Alder has a really good volunteer program, and it's something that I know especially some of our assistants that have started recently have gone through the volunteers program to be involved with physio, to be involved within the paediatric ward experience and everything, to then look into going on to applying for jobs or applying to uni, all those type of things. It can also be outside of healthcare as well. So I know people that have done it within like scouting or girl guiding, or there's like the CPFC, so Cerebral Palsy Football Club, so volunteering to work with children with cerebral palsy, teaching them football. Can just be general football training or rugby training or whatever it is that you're then involved with, that then helps you to demonstrate that you're involved with kids, and that's with your paediatric experience as well, and that you're volunteering, you're in this environment. In terms of getting into a job at Alder, they tend to want paediatric experience. That can be as a student on your placements. It can also be as a qualified, so different hospitals will have peds wards or have like times where you can have paediatric experience, and then like we said, all that non-clinical element of it as well. And then finally, just a little bit of advice for current students. So I think the most important thing is that you understand physio, you understand what it is, what we do, why you would want to be a physio, and all of the different aspects of it as well. So like we said, not just kind of already pinning yourself into one box or one type of physio, but you understand the whole role, all of the different areas that we can be working in. Make sure that you volunteer or get work experience within a healthcare environment, especially within physio itself, and have that range of experience as well is really important. Look into what the right pathway is for you, so whether it's the BSc, the MSc, or the apprenticeship, finding out what you think will be best for you, how you'll best learn, and kind of going from there. Take advantage of all the experiences that you have when you're looking into physio. If you're a physio student, once you're qualified, there's no bad experience. Everything is going to be helpful to you, even if it's not what you ultimately want to go into or want to specialise in. The more experience you have, the better of a well-rounded physio you will be. So take advantage of it all, learn, do everything that you possibly can. And then if you want to go into paediatrics, it's having that paediatric experience. So looking at different ways that you can get into a clinical environment within paediatrics is really, really important. So yeah, any questions? I think I have muted where you are. So let me get
okay.
again.
Yeah, thanks so much for that. So thanks so much for that, Eleanor. That was great, and it's just